The way we view COVID-19 today is very different from a couple of years ago. And while many people may have put the pandemic behind them, we've come to Memphis to meet with a group that is still doing outreach efforts with the vaccine to get a firsthand look at the front lines of COVID-19 in 2023.
Mr. Tuggle, come on in, hop on up here.
For as routine as a vaccine appointment may feel these days,
this is going to be his booster.
and as light as Ted Lyons keeps them,
What we do for Steelers fans is that we use large needles.
he is serious about making sure we know this work is still important.
You're in media, you know, it lasts 2 cycles. If it's not on the news cycle, the last 2 times you watch the news, they're not thinking about it anymore.
Ted and his wife, both pharmacists, launched this clinic in 2021.
And we really went all 10 toes in and used our 401ks, everything, said we're going to start this clinic.
Today, they're still working to make sure COVID vaccine access is fair, especially for Memphis's Black and brown communities, groups often at a higher risk for pre-existing conditions.
You have people who have multiple problems, you know, everything from diabetes, hypertension, asthma is really big in Memphis.
So you're seeing a lot of people come in here who have problems that COVID could still be a very serious issue.
Exactly.
Do you still worry about COVID?
Yeah, because I had a brother that died from it.
I'm sorry to hear that.
Yeah, I had a brother that died from it 2 years ago, so yes, it's important.
Loss may drive Stephen Tuggle to get his shots, but much of Ted's work is vaccinating people at outreach events.
This is the battery packs that run them. These battery packs last 12 hours.
In 2023, portable freezers like these make it easy to transport doses to areas that don't have easy access to pharmacies.
And we have to go to where people are. And that's why we started this, where we wouldn't be just a brick and mortar clinic, but we'd be primarily mobile. We go everywhere.
Only about 1% of COVID cases in the U.S. today are deadly, according to Johns Hopkins.
It is different now. Our world is different.
I checked in with rural Michigan ICU nurse Michelle Hurd. I last spoke with her in 2021 when she was treating a COVID surge. Then she told me most of her patients wouldn't survive. But today she says you can count the amount of COVID cases in her unit on one hand, although cases have risen in certain parts of the country in recent weeks.
My world will always have COVID in it. I just plan on it. It's what we should do. We should always be looking for what's new in the research, how we can better treat these patients.
Mr. Taylor, how are you doing today? Doing good. Come on through here.
For Ted and the patients we met at his clinic, their answer to moving forward in a world with COVID is a mindset many have had from the beginning.
I don't know if it's going away or when will it go away, but if it's out there, I want to be sure that I'm covered and I don't want to, hurt someone else.
Chris Stewart, Scripps News, Memphis.